Hello everyone, I am Dr. Ekta Bhushan, teaching anatomy and physiology of exercise and sports medicine at Indira Gandhi Institute of Physical Education and Sports Sciences, University of Delhi. I welcome you all to online lectures of CEC-UGC. In this series, we will discuss different topics associated with sports medicine, but today in particular, we will discuss the topic short wave diathermy. So, short wave diathermy is a renowned and effective modality to reduce pain, swelling, and discomfort or other joint conditions. This treatment is the most common and typical used by the physiotherapists using high frequency electric current via short waves. It produces heat from sound and electricity by converting processes. The heat is produced at around 27.2 megahertz. It heats tissue deeply, around 2 to 3 centimeter. In that case, the therapist decide how much temperature is required to generate within the target issue. So, short wave diathermy is the most effective treatment to reduce swelling, pain, relieving pain, reduce inflammation, increase joint movement, and increase tissue extensibility. The electric pulse creates heat and targets the tissue deeply so that the patient can gently improve their flexibility in the stiff joints and connective tissues. For the target heat, blood flow can improve and decrease pain and inflammation. So, let's discuss the definition of short wave diathermy. So, the term diathermy means through heating or producing deep heating directly in the tissues of the body. So, dia means through and thermi means heat. So, it stimulates the circulation, relieve pain, enhance rate of recovery of recovery healing tissues. So, the heat can help with various processes including increasing blood flow, relieving pain, improving the mobility of tissues as they heat or heal. So, let's discuss the types of diathermy. So, the first one is the short wave diathermy. Short wave diathermy uses high frequency electromagnetic energy to generate heat. It may be applied in pulsed or continuous energy waves. It has been used to treat pain from kidney stones and pelvic inflammation diseases. So, short wave diathermy is commonly used for conditions that cause pain and muscle spasm such as ligament sprain, muscle strain, bursitis and tenosynovitis. The next one is microwave diathermy, and microwave diathermy uses microwaves to generate heat in the body. It can be used to evenly warm deep tissues without heating the skin. Since it can't penetrate deep muscles, it's best suited for areas that are close to the skin such as the shoulders. Then ultrasound diathermy. Ultrasound diathermy uses sound waves to treat deep tissues. Heat is generated by the vibration of the tissue. This promotes blood flow into the area. And ultrasound diathermy is used for the treatment of musculoskeletal strain, muscle spasm, joint contraction or adhesions or neuroma. Now we will discuss how does short wave diathermy work. So, the diathermy machine does not apply heat directly to the body. Instead, the waves generated by the machine allow the body to generate heat from within the targeted tissue. And diathermy is usually part of complete physical therapy or rehabilitative regime, frequency and length of treatments vary. So, frequencies used in diathermies are 27 there are three frequencies. One is 27.12 megahertz wavelength, and that goes to 11 millimin. Then 13.56 megahertz wavelength of 22. Then 40.68 megahertz wavelength 7.5. So, shortwave diathermy uses high frequency electromagnetic energy to generate heat. It may be applied in pulsed or continuous energy waves. It has been used to treat pain from kidney stones and pelvic inflammatory diseases. It's commonly used for conditions that cause pain and muscle spasms such as sprain, strain, bursitis, or tenosynovitis. Then, what are the benefits of shortwave diathermy? So, treating injuries with heat can increase blood flow and make connective tissues more flexible. It can also help minimize inflammation and reduce incidence of edema or fluid retention. So, diathermy is used to treat the following condition: arthritis, back pain, fibromyalgia, muscle spasm, myositis, neuralgia, sprain and strain, tenosynovitis, tendinitis, bursitis. However, there is still not a lot of evidence to prove that diathermy is the most effective treatment for these conditions. What are the risks of diathermy? So, the electromagnetic energy used in shortwave and microwave diathermy can cause extreme heat in metal devices such as bone pins, dental filling, metal surfaces. The cold cause burns in the tissue near the implants. So, the procedure should not be used over these areas to avoid the risk of burning. During diathermy treatment, you become a part of the electrical field. Touching a bare metal object, including a metal part of the diathermy cabinet, can cause a shock or burn. Diathermy should be avoided over open growth plates in children. Now, we will see the therapeutic effect of shortwave diathermy. So, the first effect is effect on inflammation and bacterial infections. So, the arterioles and capillaries dilated boost the blood flows in the affected area and restore the oxygen supply. The increased flow of the nutritional elements and antibodies with white blood cells improves the tissues with enough fluid. So, this process removes the waste particles and cures the inflammation. Heating the tissues effective with bacteria results in the body deal with the infected organs. Now, second one is pain relief. So, the sedative effect from the electromagnetic thrust is great for relieving pain. Then, fast healing. The instant heat increases the blood flow immediately and assists the tissues to heal in a shorter duration. Then, trauma. The heating effect creates from the electromagnetic thrust works to exudate the affected fluid from the vessel, damaged vessels. This process improves the joint conditions. Now, let's look into the indications of shortwave diathermy. So, disorder of musculoskeletal system like sprain, strain, capsular lesion, degenerative joint diseases or joint stiffness. and chronic inflammation conditions like tendinitis, bursitis or tenosynovitis. Now, contraindications of short wave diathermy. So, first one is hemorrhage. So, the heating of tissue by the diathermic current causes dilation of blood vessels. So, it should not be employed directly after an injury or in any case where hemorrhage has recently occurred. It should not be applied to the abdomen or pelvic during menstruation, nor should not be used for conditions in which hemorrhage might occur, such as gastric or intestinal diseases associated with ulceration or hemophilia. The next one is venous thrombosis or phlebitis. So, these conditions contraindication the application of shortwave diathermy to the area drained by the affected vessels, as the increased flow of blood may dislodge the clot or aggravate the inflammation. Then arterial diseases. Diathermy should not apply to parts which have a defected arterial blood supply. The inability of the circulation to disperse the heat could result in an increase of temperature to a level which could produce a tissue burn. Then pregnancy. Diathermy should not be applied to the abdomen or pelvic during pregnancy. Then metal in the tissues. Metal increases heating inside the tissue and chances of burn increases and post-operative metal implants in the body. Then disturbed skin sensation. It is safer to avoid the application of diathermy to areas where there is loss of skin sensation. Then tumors. Shortwave diathermy should not be applied in the region of malignant growth. The increase in metabolism resulting from the increase in temperature could accelerate the rate of the growth. Then X-ray. X-ray devitalize the tissues and render them more susceptible to damage. So, shortwave diathermy should therefore not be applied to areas recently exposed to therapeutic doses of X-rays. Then patients at particular risk. It is unsafe to apply shortwave diathermy to patients who are unable to understand the degree of heating required and the necessity of reporting excessive heat. For this reason, small children and mental defective are not suitable for treatment. Similarly, it is not safe to treat unconscious patients or those who are liable to lose consciousness, such as epileptic. Now, we will see the physiological effects of shortwave diathermy. So, this is the chain, this is the process which goes through, like first heat produce, then increases diameter of blood vessels, then increase blood circulation, then remove waste products, then increases nutrient supply in the affected area, then relieve pain or reduce muscle spasm. So, this is the chain of physiological effect of shortwave diathermy. Now, who are unqualified for diathermy? We'll see those who have a pacemaker, then prosthetics, then any IUD, or you may not be an appropriate candidate for this treatment if you have cancer, reduced skin sensation, peripheral vascular disease, or tissues with restricted blood supply, infections, or fractured or broken bones, bleeding disorder, severe heat, heart, liver, or kidney conditions, low skin sensation, pregnancy, perspiration, or wound dressings. Now we'll see how does short wave diathermy work. So, the distinguished form of diathermy is the short wave diathermy. It sends high frequency waves inside the human body and lets the wave reach the affected tissues. So the conventional machines of short wave diathermy works at 27.33 megahertz that have wavelength of 11 meters, and like other wave lengths, short wave diathermy works in two different modes, that are a continuous mode. First, when the physiotherapist uses continuous mode, the wave continuously convey energy and create heat in the target tissues area. If the physiotherapist find the affected area worse and need more heat, then they opt for continuous mode. The other one is pulsed mode. For comparatively minor issues, physiotherapists opt for pulse mode. The good part of this mode is that it helps to increase flexibility and mobilizations in the joint. So when applied to the patient's body, the wavelength creates heat from within the affected area and stimulates blood circulation that helps to relieve pain and improve physical conditions. Immediately the cell get accelerated in the growing process and damaged cells get regenerated. That's how we experience the heat progress in the wounded area. Now, how we can prepare the patient? So ensure that patient is free of all contradictions and patient must be comfortable and the part to be treated is fully supported. Then remove all the jewelry, coins and metallic items from the patient. The treatment tissues should not be covered by clothing. Wash the skin over the treatment area. Thoroughly dry the skin prior to the treatment. Then for personal safety, the therapist remove watch, rings and bracelets, so on. Treatment should be on the couch, chair or a table which must be wooden and free from metals. The skin must be dry. Skin sensation must be tested before treatment starts. Then how we'll monitor the treatment? So before starting treatment, all metals of apparatus should be on 0 position, starting position. Then select the power level according to the patient's condition. Increase the intensity gradually till the desired heating level is reached. Then immediately check for any complaint of hot sensation. Then the physical therapist should remain within a call of the patient during the whole treatment of the period. At the end of the treatment, the control knobs are returned to 0 position, current switched off and the electrodes removed. Now, dangers or precautions of short wave diathermy. Proper connection of machines and electrodes. Ensure the earthing of the machine. Do not allow the patients to touch the unit or burn. Now we have come to the conclusion of short wave diathermy. So diathermy is a treatment modality that is most commonly used for joint conditions such as rheumatoid arthritis or osteoarthritis. The term diathermy refers to the creation of heat using electrical pulses. In diathermy, a high frequency electric current is delivered by short wave, microwave and ultrasound, which is able to generate deep heat in body tissues. The heat can be used to improve circulation and to relieve pain. In addition, shortwave diathermy can be used in medicine for treating damaged tissues and relaxing muscles. So, I hope you understood the concept of shortwave diathermy, its important and implication, its indications and contraindication. That's all for today. See you next time. Thank you.